Session 3B, Drug Actions Continued. Presented by Honorary Associate Professor Louis Roller. February 2011.
So from the pharmacokinetic point of view, what we have to consider is the process of what happens to the drug when the medicine is taken in a particular dose form. So if I swallow a tablet containing a certain amount of a particular medication, it will go straight into the stomach, where in the stomach the tablet will break up and release particles of the combination of the drug with other excipients that are there, and some of the drug will go into solution. And it is really important that the drug goes into solution for it to be absorbed. Without dissolution, as it's called, within the gastrointestinal tract, absorption does not occur. So drug absorption depends on several factors. That is the physical and chemical properties of the drug. Things like solubility of the drug. That's really, really important. How soluble is it in an aqueous environment? The basic chemical nature. Is it a large molecule? Is it a small molecule? The type of the product administered and the dosage form. And I've already mentioned tablets, but it could be capsules. It could be, if it's taken orally, which a great bulk of medications are taken orally, as was mentioned in a previous talk by Dr. Gowan. It is really important how the drug is released from the dose form. So you've got the disintegration from the tablet or the capsule to release the product. Then you have to have the actual drug going into solution. And one of the important aspects, if we go back to the first point, physical and chemical properties, the nature, those particular properties will impart on the actual chemical that we are going to try to absorb, is going to lead to appropriate dissolution. And another aspect of that is that the particle size of the medication is important. Many of our drugs are not very soluble in an aqueous environment. As you increase the particle size, you decrease the solubility. So we want to decrease the particle size, or if you like, increase the surface area, which allows the aqueous environment to actually dissolve these particular small particles. So the smaller the particle, the more likely it's going to go to dissolve. The more likely it dissolves, the more likely it will be absorbed. Now, drugs absorbed intravenously do not undergo absorption. However, as mentioned in Dr. Gowan's previous talk, when she talked about other dose forms, so for instance, you've got rectal dose forms for systemic use, that has to undergo absorption through the rectal membranes in that case. That's part of the gastrointestinal tract, just the other end. But if drugs, given by injections, such as intradermal or subcutaneous or intramuscular, they do go through a different absorption process, release process. But if they're given intravenously, that is directly into the vein, then they do not undergo absorption. The drug is really delivered into the vein where it's already in solution. Has to be in solution. So you'll find, generally speaking, intravenous dose forms tend to be solutions. That the drug is in solution, not in suspension. So what is bioavailability? Well, bioavailability describes the rate and extent of drug absorption. So bioavailability of drugs is administered IV. If it's given intravenously, you can call that 1, or if you like, 100%. So we know it's bioavailable or available to the tune of 100% if it's given intravenously. However, if we give something orally, rectally, or by other parenteral forms other than intravenous or patches, then the bioavailability is going to be different. It's going to be somewhat less. It could be significantly less, or it could be marginally less than the intravenous dose form. So absolute bioavailability is the amount of drug in systemic circulation after extravascular administration. So usually less than 1, as I've already said, and it's compared, so when we talk about bioavailability, we compare it to the IV. We also have the concept of relative bioavailability. That is the amount of medication in the system, systemic circulation, compared to a reference product administered by extravascular administration. So in Dr. Gowan's original talk, she mentioned the fact that we've got different brands of the same drug. And she mentioned quite correctly that these are considered to be bioavailable, or they have bioequivalence within plus or minus 10%, which is as best as you can hope for. So that we, in Australia, we have a very rigid system of testing, as again mentioned earlier, but it's important to reiterate it, of the quality and the bioavailability of the particular product that is being used.